Hello and welcome to Senior Health Tips. Let me ask you something. Have you been feeling more tired than usual lately? Maybe your muscles ache for no clear reason, or perhaps your hair isn't as full as it once was, or your mood just feels a little off. Has someone close to you even mentioned that you seem a bit more irritable these days? If any of that sounds familiar, you're not alone. What many people don't realize is that these could be quiet signals from your body, warning signs that something essential is missing. There's a vital nutrient that plays a powerful role in keeping your blood flowing smoothly, your heart strong, and your energy steady. But today, far too many seniors are unknowingly running low on it. And when this nutrient dips too low, circulation problems can sneak up without much warning. You might not even realize it's happening until bigger issues show up. In today's video, we're uncovering exactly what happens to your circulation when your body lacks this critical support, and even better, we'll share simple, practical tips to help you stay ahead of the problem. So stick with us, because by the end of this video, you'll feel more confident about how to protect your blood vessels, boost your energy, and keep moving strong every day. If you know someone who's been struggling with low energy, unexplained body aches, or mood swings, consider sharing this video with them. It might just be the information they've been missing. And we'd love to hear from you too. Have you ever wondered if something small could be quietly affecting how you feel? Drop a comment below, and let's chat. Now let's talk about why circulation matters so much, especially as we get older. You see, when we're young, our blood vessels are flexible, strong, and responsive. Blood moves easily through our bodies, delivering oxygen and nutrients exactly where they're needed. But as time goes on, things naturally change. Our arteries can stiffen, tiny blockages can start to form, and without strong, healthy circulation, our muscles, brain, heart, even our skin, don't get the nourishment they once did. Poor circulation isn't just about feeling cold hands and feet either. It can mean slower healing when you get a cut. It can make walking longer distances feel harder than it used to. It can even affect your memory, your balance, and your energy. And over time, circulation problems raise your risk for some of the most serious health issues, like heart attacks, strokes, and even dementia. This is why protecting your blood flow isn't just about comfort. It's about keeping your independence, your vitality, and your quality of life. Here's something to think about. Have you ever noticed how some seniors seem sharp, energetic, and active even into their 80s and 90s? One of their biggest secrets is often something simple but powerful. They've found ways to support healthy circulation every single day. At Senior Health Tips, we believe that protecting your blood flow is one of the best gifts you can give yourself as you age. And the great news is, it doesn't have to be complicated. Small daily choices can make a big difference. In a minute, we're going to reveal the hidden nutrient that plays a starring role in keeping your circulation strong. But first, we'd love to hear from you. Have you ever experienced signs of poor circulation, like cold fingers, numbness, or slow wound healing? If so, drop a comment below. You're definitely not alone, and sharing your experience might help someone else too. Alright, let's keep going, because what you're about to learn could change the way you care for your heart and body from today forward. So, what exactly is this missing link that's quietly affecting so many seniors' blood flow? It's something simple, yet absolutely vital. It's a nutrient that your body needs not just for strong bones, which you've probably heard about, but for keeping your blood vessels flexible, your heart steady, and your circulation flowing like it should. Without enough of it, the walls of your arteries can become stiff and inflamed. Tiny cracks can start forming inside your blood vessels. Over time, this can lead to blockages, slow blood flow, and increase the risk of serious events like heart attacks and strokes. The good news, when you maintain healthy levels of this nutrient, your body can better regulate blood pressure, reduce inflammation inside blood vessels, and even prevent some of that dangerous buildup that slows circulation down. So what is this powerful helper? It's a vitamin, but not just any vitamin. It acts more like a hormone, signaling cells throughout your body to stay strong and healthy. And while most people think of it mainly for bone health, the truth is, it's one of the most important players for your entire cardiovascular system too. If you haven't guessed it yet, we're talking about vitamin D. Yes, vitamin D is crucial not just for bones, but for your arteries, your heart, and your overall blood flow. Unfortunately, because of modern lifestyles, spending more time indoors, covering up from the sun, aging skin that doesn't produce vitamin D as efficiently, so many seniors end up with low levels without even realizing it. That's why today's video is so important, because boosting your vitamin D isn't complicated, and doing so can dramatically support your circulation, your energy, and even your mood. In a moment, we'll show you exactly what happens inside your blood vessels when vitamin D runs low, and what simple habits you can start today to turn things around. But before we dive deeper, take a second to think. When was the last time you spent 15-20 minutes outside, soaking up natural sunlight? If it's been a while, don't worry, you're not alone. And don't worry, there are other ways to give your body what it needs too. Let's explore them together. Alright, now that we know how important vitamin D is for circulation, let's talk about something just as important: the early signs your body might be giving you. You see, when we think about circulation problems, most people imagine big, dramatic symptoms, things like chest pain or severe numbness. But the truth is, poor circulation and low vitamin D levels often whisper before they shout. And if you know what to watch for, you can catch the warning signs early and take action before bigger problems show up. Here are some of the surprising symptoms you might be overlooking. First, unusual fatigue. Not just feeling tired after a busy day, but that deep nagging exhaustion that doesn't seem to go away, even after resting. If you've been feeling more drained than usual without a clear reason, your body could be struggling with blood flow. Second, muscle aches and weakness. When your muscles aren't getting enough oxygen and nutrients, they can start to feel sore, heavy, or simply not as strong as they used to be. Third, mood changes. Low vitamin D has been linked to feelings of irritability, sadness, or even mild depression. If you've noticed your mood shifting without an obvious cause, it could be more than just getting older. It could be your body's way of asking for help. Fourth, hair thinning. Yes, even your hair can tell the story. Poor circulation can mean fewer nutrients reaching your scalp, leading to hair that's thinner, weaker, or falls out more easily. And finally, slow healing. If small cuts or bruises seem to linger much longer than they used to, that's another potential red flag that your circulation isn't as strong as it should be. Here's a gentle reminder: none of these symptoms by themselves automatically mean you have a serious problem. But if several of them sound familiar, it's worth paying attention, because small changes today can make a big difference for your health tomorrow. We'd love to know, have you experienced any of these subtle signs yourself? Drop a comment below and share your experience. You never know who you might help by speaking up. In the next part, we're going to explore exactly how low vitamin D damages your blood vessels behind the scenes. And trust us, it's something you'll want to know about. Stay with us. Now, let's take a closer look at what actually happens inside your blood vessels when your body doesn't get enough vitamin D. You might be surprised. It's not just about weaker bones or low energy. Low vitamin D levels can set off a chain reaction that damages your arteries from the inside out. Here's how it works. Vitamin D helps regulate something called endothelial function. That's just a fancy way of saying it keeps the inner lining of your blood vessels, the endothelium, healthy, smooth, and flexible. When vitamin D is low, this delicate lining starts to get inflamed. Tiny cracks and rough spots can form, making it easier for harmful substances like cholesterol to stick to the walls. Over time, these sticky patches can turn into plaques, hard buildups that narrow your arteries and block blood flow. This condition is called atherosclerosis, and it's one of the main causes behind heart attacks and strokes. But that's not all. Low vitamin D also affects the muscles around your blood vessels. Normally, these muscles help your arteries expand and contract to keep blood moving efficiently. Without enough vitamin D, they can stiffen, losing their natural flexibility. This can cause your blood pressure to rise, putting extra strain on your heart every single day. And here's something even more concerning. Research shows that low vitamin D levels are linked not just to artery narrowing, but also to artery weakening. This weakening can lead to aneurysms, those dangerous balloon-like bulges in blood vessels that can rupture without warning. In simple terms, lacking vitamin D is like leaving your blood vessels unprotected, more vulnerable to inflammation, damage, and dangerous changes over time. The good news is, you're not powerless. Knowing how vitamin D supports your circulation gives you the chance to take proactive steps before small issues become bigger threats. Have you ever thought about how something so tiny, so easy to overlook, could play such a big role in keeping your heart and arteries healthy? It's pretty amazing, isn't it? Up next, we'll dive deeper into the biggest dangers linked to poor circulation, including strokes and heart attacks, and why seniors need to stay one step ahead. Stay with us, this next part could be a real eye-opener. Now that we understand how low vitamin D can quietly damage your blood vessels, it's time to talk about the real risks that come from ignoring these early warning signs. Let's start with strokes. When blood flow to part of your brain gets blocked, even for a few minutes, brain cells can start to die. This can lead to sudden confusion, trouble speaking, weakness on one side of your body, or even life-changing disability. Poor circulation and narrowed arteries, both linked to low vitamin D, make these dangerous blockages more likely. Next, heart attacks. Your heart needs a steady, strong flow of blood to keep pumping efficiently. When arteries around the heart become clogged or inflamed, they can't deliver enough oxygen-rich blood. Sometimes, a small blood clot can get trapped in a narrowed artery, cutting off blood supply and triggering a heart attack. And it doesn't stop there. Poor circulation has also been linked to problems like peripheral artery disease, where blood flow to your legs and arms becomes limited. This can cause painful cramps when walking, cold or numb extremities, and in severe cases, even increase the risk of infections or amputations. Low vitamin D levels have also been connected to high blood pressure, a major risk factor for both strokes and heart attacks. When your arteries stiffen and lose flexibility, your heart has to work harder just to move blood around, wearing it out over time. And here's something else. Studies suggest that low vitamin D may even be related to cognitive decline and dementia, possibly because poor circulation reduces the blood flow that your brain needs to stay sharp. So it's not just about feeling a little tired or having cold hands. Low vitamin D touches almost every part of your circulatory system and can affect your heart, brain, and quality of life in ways you might not expect. The key takeaway here: taking care of your blood vessels today means protecting your independence, your mobility, and even your memories tomorrow. In just a moment, we're going to explore why some people struggle more than others to maintain healthy vitamin D levels, and why it matters more than you might think. Stay tuned. Now, you might be wondering, if vitamin D is so important, why do so many seniors still end up running low? Well, the truth is, there's a lot more to it than just not eating enough vitamin D-rich foods. Several natural factors can make it harder for your body to maintain healthy levels, even if you're trying your best. First and foremost, sunlight. Our skin needs direct sunlight to make vitamin D naturally, but today, many of us spend hours indoors, working, relaxing, staying safe from harsh sun rays. Even when we do go outside, we often cover up with clothing, sunscreen, or hats to protect our skin, which is great for preventing skin cancer, but it also blocks the UVB rays needed for vitamin D production. Second, the natural aging process. As we get older, our skin becomes less efficient at producing vitamin D from sunlight. In fact, A senior's skin can produce about 25–30% less vitamin D compared to someone younger, even with the same sun exposure. Third, skin tone plays a big role too. People with darker skin have more melanin, which reduces the skin's ability to make vitamin D quickly and efficiently. This means some seniors may need even more sun exposure to produce the same amount of vitamin D as someone with lighter skin. Fourth, weight matters. Vitamin D is fat-soluble, meaning it gets stored in fat tissue. If someone is carrying extra weight, more vitamin D gets trapped in the fat cells, making less available to the rest of the body. And finally, health conditions and medications. Issues like kidney disease, liver disease, digestive disorders, and even some common medications can interfere with how your body absorbs and processes vitamin D. All of these reasons explain why it's so common for seniors to have lower vitamin D levels, even if they eat well and spend time outside. Understanding this helps you be more proactive, because sometimes your body needs a little extra help to get what it needs. Up next, let's explore why balancing your vitamin D level, not too low, not too high, is the real key to protecting your blood flow and your overall health. You're doing something wonderful for your future by learning about this. Stay with us. Now that we understand why vitamin D can be low, let's talk about something equally important: balance. When it comes to vitamin D, more is not always better. Just like having too little can harm your blood vessels, having too much can cause problems too. Low vitamin D, as we discussed, weakens blood vessels, promotes inflammation, raises blood pressure, and increases the risk of heart attacks and strokes. But too much vitamin D can cause calcium levels in your blood to rise too high, a condition called hypercalcemia. When calcium builds up excessively, it can harden your arteries instead of strengthening them. This can make blood flow even worse and put you at greater risk for serious circulation issues. That's why it's so important to aim for a healthy middle ground. Most experts recommend keeping blood levels between 30 to 50 nanograms per milliliter, (Nga/Nl) for optimal health. This range supports your bones, your blood vessels, and your heart, without the dangers of oversupplementation. So how do you stay balanced? First, get tested. A simple blood test can tell you exactly where your vitamin D levels stand. It takes out the guesswork and gives you a clear picture of what your body needs. Second, be mindful with supplements. If your doctor recommends vitamin D supplements, follow their guidance closely. Avoid high doses unless absolutely necessary, and always recheck your levels after a few months. Third, combine natural sources, like moderate sun exposure and vitamin D-rich foods, with supplements if needed. This layered approach helps maintain healthy, steady levels without going overboard. And fourth, remember that your vitamin D needs might change over time. Health conditions, new medications, weight changes, all of these can shift how much vitamin D your body needs to stay balanced. Think of vitamin D like a thermostat for your circulation. You don't want it too low or too high. You want it just right. Coming up next, we'll show you simple, everyday ways to boost your vitamin D safely and naturally, so you can keep your blood vessels strong for years to come. Stay tuned. Alright, so now the big question: how can you safely boost your vitamin D and protect your circulation? The good news is, it's not complicated. And even better, small daily habits can make a big difference over time. First and most naturally, sunlight. Our bodies are designed to make vitamin D when our skin is exposed to sunlight, especially UVB rays. Spending about 15–20 minutes in the sun a few times a week, preferably with your face, arms, or legs uncovered, can often help maintain healthy vitamin D levels. Of course, if you're at high risk for skin cancer, or if your doctor has specific advice, always follow that first. Safety comes first. Second, your diet. There are several foods that naturally contain vitamin D, and adding them to your meals can give you a nice boost. Look for fatty fish like salmon, tuna, and mackerel. Egg yolks, fortified milk, fortified cereals, and even fortified orange juice can also help. Third, supplements. When needed. If your blood test shows that you're low in vitamin D, your doctor might recommend a supplement. There are two main forms, vitamin D2 and vitamin D3. But research suggests that D3 is a bit more effective at raising and maintaining healthy levels. Always work with your healthcare provider to choose the right type and dosage for you. Fourth, consistency matters. Boosting your vitamin D is not a one-time fix. It's about small, steady habits. A little sunshine here, a balanced meal there, regular check-ins with your doctor. That's what creates lasting change and keeps your blood vessels happy and healthy over the long haul. And fifth, listen to your body. If you start a new supplement and notice unusual symptoms, like nausea, confusion, weakness, or excessive thirst, reach out to your doctor. Those can be early signs of too much vitamin D, and it's always better to catch it early. Taking care of your vitamin D levels isn't about making huge, stressful changes. It's about building small, easy habits into your life that support your circulation, your energy, and your overall well-being. Coming up next, we'll talk about a powerful silent partner that often works alongside vitamin D to protect your blood vessels, and you might not even know you need it yet. While vitamin D gets a lot of attention, and for good reason, there's another important player in the background. Vitamin K2. Vitamin K2 often works hand in hand with vitamin D to support your circulation and protect your arteries. Here's how. When your body absorbs calcium, thanks to vitamin D, vitamin K2 helps direct that calcium to the right places, like your bones and teeth, where it's needed most. Without enough vitamin K2, there's a risk that calcium could end up where you don't want it, inside your blood vessels, leading to stiff, hardened arteries. So while vitamin D helps you absorb calcium, vitamin K2 acts like a traffic director, making sure it goes exactly where it should. That's why many experts now believe that getting enough vitamin K2 is just as important as maintaining healthy vitamin D levels, especially for seniors looking to protect their circulation. You can find vitamin K2 naturally in foods like fermented soybeans, natto hard cheeses, egg yolks, and certain meats like liver. There are also supplements available, but as always, it's best to talk to your doctor before adding anything new. Remember, it's not about rushing out to buy more pills. It's about understanding how these nutrients work together, like a team, to keep your blood vessels flexible, your bones strong, and your heart protected. Up next, we'll talk about why prevention is everything when it comes to circulation and what you can start doing today to protect your blood vessels for life. Don't go anywhere. Now that we've learned how vitamin D and vitamin K2 work together to support healthy circulation, there's something even more important we need to talk about: prevention. When it comes to protecting your blood vessels, prevention truly is everything. Here's the reality. Once damage has built up inside your arteries, once plaques have formed or blood vessels have hardened, it's extremely difficult, if not impossible, to fully reverse. Modern medicine can help manage the damage, but it can't erase it completely. There's no magic pill that can unclog hardened arteries or remove years of inflammation. That's why catching problems early, and even better, preventing them from starting, is the smartest, most powerful thing you can do for your heart and circulation. The good news: prevention doesn't have to be complicated or overwhelming. It's the small, steady choices you make every day, like supporting your vitamin D and K2 levels, staying active, eating nourishing foods, keeping an eye on your blood pressure, and listening to your body. Each small step might seem simple on its own, but over time they build up like drops filling a bucket, strengthening your blood vessels, protecting your energy, and helping you stay independent, active, and sharp for many years to come. Think of prevention like building a strong bridge. You don't wait until cracks appear. You maintain it, reinforce it, and care for it before problems start. Your blood vessels deserve the same love and attention. Coming up next, we'll wrap things up with a simple daily habit you can start today to support stronger circulation for life. Stay with us. You're almost there. Congratulations, you've made it to the end of this important journey with us. Now we want to leave you with one simple, powerful idea. Small steps taken every day can lead to big changes over time. If you do just one thing starting today, let it be this. Make caring for your circulation part of your daily routine. Get a little safe sunlight when you can. Enjoy nourishing meals that include foods rich in vitamin D and K. 2. Stay active in ways you enjoy. Even gentle walks or light stretching can do wonders for your blood flow. And stay curious about your own health, checking in with your doctor when needed, asking questions, and learning what your body needs to thrive. You don't have to do everything all at once. It's the little habits, built with love and consistency, that make the real difference. Because your blood vessels, your heart, your mind, they're all counting on you. And the more you care for them today, the more freedom, energy, and joy you'll have for the days and years ahead. If today's video gave you even one helpful idea, we'd love to hear about it. Drop a comment below. What's one small habit you're excited to start? And if you haven't yet, don't forget to subscribe to Senior Health Tips, and be sure to tap the notification bell so you never miss a new video. We're here to support you with simple, practical ideas to help you live your healthiest, happiest life. Take good care, and we'll see you in the next video.